The background of Albury Wodonga Aboriginal Health Service is that the community for many years was working towards creating a health service. I don't know whether it would be one of the larger towns in New South Wales, Victoria, because of course we're on the border here, that didn't have a Indigenous health service, but certainly it was a significant need, and a number of the Aboriginal cooperatives and organisations in town all gathered together and worked for quite some years towards getting the service set up. By 2005, funding had been secured, a house in the middle of Albury organised to be the rooms, and staff started to be recruited.
I started here 6.5 years ago, in 2008, and there were 10 staff. There's about 41 staff here now, so we've gone from being a small medical practice to a more comprehensive health service that incorporates mental health, social and emotional well-being, allied health, drug and alcohol, child and family health services, chronic disease, the full gamut of health-related industry services.
The service has been well run and well set up by the community, well set up by the Board of Management. I remember Bruce Forrest was the initial chair, indeed chair for I think around 3 or 4 years at the beginning, and his speech at the commencement of Aboriginal Health Service here was that it was to be a service without fear or favour for all the community. So we've gone from that tiny service to now having a standalone site set up in 2009, so only 4 years after we started we were building on a greenfield site, leading to significant expansion of services.
I love working with Aboriginal health. I've been a nurse for 21 years. It is definitely by far the most challenging but rewarding role I've ever had. I love the fact that I'm well trusted. That like when you're working in a hospital, you do your task, you say see you later. It doesn't happen here. I'm a part of this community now, and like I said, people vouch for me. I'll go to Fiona, she'll help you, she helped me. I love that. And I do come through for them, I believe that I do. And if I can't, I don't stop, I'll hand it over or refer on or whatever, but we just don't stop. We don't say we can't help you. We don't stop until we can help.
I really like working here because I get to take more of a holistic approach, because sometimes in counselling you're in the room for 1 hour and then the client goes, but here I'm able to then do some more social work on the side, so help them look after like housing or Centrelink, as well as address their traumas and crisis, because sometimes when people, if they haven't got enough money or haven't got housing, it's very hard for them to concentrate on counselling. So being able to help them that way, I find is a much better approach for them.
Casey, my name is Domi, the dentist work here, and we just kind of do a general checkup and see what it looks like. When I first joined, that's 2011, and some Aboriginal elders, quite honest, they're probably late 60s, early 70s, and even a bit older. They never been to a dentist for their life, and there's lots of barriers there to come and sit on this dental chair. And they had lots of myths and stories, and initially it's a little challenge to get their trust, but once you speak with them and when they got used to the way you work, and it's very easy.
One of the great things about this job as a general practitioner is that there's a huge variation in the things you see.
Come in, Selena.
Yep.
How are you?
Yeah, good, thank you.
How's your baby?
Yeah, she's good.
Large amounts of mental health work and diagnosis and treatment of anxiety, of phobias, of depression, of schizophrenia, of other problems.
Sorry.
Hello. We have a number of children as well. Large numbers, lots of paediatrics. It's huge and broad, and anything from sorting out minor fractures and obviously acute injuries and wounds to difficulties of post-traumatic stress disorder, unfortunately, difficulties such as sexual assault and sexual abuse, but wonderful tales of people's survival and people's progression through life.
What if I take your blood pressure?
That makes the job very satisfying, very enjoyable. It can push your skills. Anybody who's worked in rural health will know that there are difficulties with resources, there are difficulties with gaining expertise, there are great difficulties within mental health services, and what we've tried to do is continue to develop our skills within this service.
Because here we can do it all. Sometimes when you refer clients out to other services, you don't know how good or if they connect with that service. So being able to do it all from one place, it helps them with their whole life picture, because usually if there's a mental health issue or a drug and alcohol problem, there's usually other issues, that go along with that. So being able to address all of those and the medical issues at the same time is extremely helpful for the clients.
I also enjoy the people that I work with, and I actually love the community. I think the community educate me every day in my work. And sometimes I sit in my office and bang my head against the wall, trying to do some stuff. But to come out and be part, be in the waiting room for a little while is just a relief sometimes. And I really like it.
If a patient's concerned and worried and fearful of going to another service, understandable, they often won't get there.
Perfect. Good.
If you can take someone and introduce them to a worker within your service, even if it's just to make that contact, hello, even if it's an appointment that comes along later, making that connection is very, very important. And word of mouth is absolutely critical within Indigenous culture, clearly. Developing those local expertise and developing in-house referrals and teamwork is the way the place works.
The cultural training side of things has always been an issue in regards to it's needful, it's necessary, and in the past different individuals or Aboriginal health workers were responsible for doing it, even though it's not actually in their position description. So what they did, we took up the ante and decided to create a position, and then we sourced funding for that position where we actually have someone like myself in a paid position to keep their finger on the pulse of all things cultural at the health service. And when new staff come on board, Aboriginal and non-Aboriginal, then it's about making them feel welcome, making them be aware of the local Aboriginal community and issues. For non-Aboriginal staff that we've had here, some are Australian, others are been international, so it's an important introduction for them into the health service and Aboriginal culture in general.
Working here, the difference with the other places I used to work, and it's like it's more like the Aboriginal community is the close community. When I go outside, when I meet them and they got the fillings and dentures and things are done, and they're very appreciative, and you get the feedback, and hey, I'm not just another white coat dentist here. They consider me like the brother, hey bro, you done this film good, and I'm smiling now, you make me smile. I like a bit more casual way, and yes, and it's a bit different, and I really enjoy that.
Making people aware who are training and thinking of practicing medicine in Australia that you'll come across Aboriginal patients, and we're similar but not the same, and some of the common traits that you will find and some of the things that you need to be aware of on a national level and then also in the local area. And it's benefited the doctors and their training, and it's a program that's gone on for a number of years now, and this is my second year in the job.
We have around 60% Indigenous staff, and we're very lucky. We actually have quite a low staff turnover and a good collegiate atmosphere.
At times, the other thing I've noticed here at AWAHS is we're getting young Aboriginal trainees in, and some of them come from homes where they're just learning their Aboriginal heritage, or they haven't had much opportunity to learn their culture. And so as the cultural officer here, I'm supporting them as well. They have questions, and they come along to different programs and get to learn and understand while they're here as an employee. So I saw the benefit in being a support person for them as well as non-Aboriginal staff.
This is the men's shed. We do a lot of woodwork and creating digits and other designs. There's a couple up here, like boomerangs and stuff. A couple of emu eggs that have been done.
At that stage when they received funding to build a new health service, we were growing, enlarging and so forth. They had a lot of community consultation, and there was a few male voices that put across the concept of having a place down the back of the health service dedicated for a men's shed or a gathering place for men to do programs and so forth to support the guys. And so when the new health service built here in Daniel Street, Glenroy, they had the slab put down, a large shed put on there, and it was always allotted to be the men's shed.
Yeah, we just do what you want to do. Make a didgeridoo, make boomerangs, kite sticks, whatever you want. Yeah, it's a really good place to be. Yeah, there's heaps of chatting, you talk a lot, you get to know each other, make new friends. Darren is a great person to talk to. He has a lot of knowledge.
The benefits are that the shed is connected and auspiced by the health service. Some guys are connected to the men's shed via the services here, drug and alcohol, mental health, and so they get referred to us as a way to connect with the other men in the community, as a way to battle depression and being stuck at home, just to get out and connect with other Aboriginal guys, and then learning culture. We have a capacity to do artefacts and artwork, as well as stories and dance. We've been involved in some community projects where we've sort of consulted for other areas in the community, sculptures and artworks and programs. So we've become an entity in ourselves, which is really good. Knowing that we're connected to the health service means that at any time the guys that come along don't feel so well or struggling with different issues, then there's quite an array of health professionals that they can talk to here at the service.
I was walking down the river one day and I just spotted it, and I said it looked like a walking stick, so I cut it from the bottom, brought it back to the men's shed and worked with it and put a few designs on it. That designs mean the rivers. These are the walking tracks. These are the Aboriginals that walk from one water hole to another. And these are the tribes that are sitting around the water holes. And up here is that sign there is where they all meet, do their trading. It's like a supermarket. But when it's finished, then they go back to where they come from water hole to water hole. Take months and months and months. And they just journey on until they finish up back home again. You've got to have a good eye to see anything that you can make of the river because it's natural. And if you can spot, this is the sort of thing that you get. You say, I can make a boomerang out of a stick, or I can make a walking stick, because it already had the bow. Need a bit of work, and that's how it finished up, beautiful. I couldn't have wished for something so beautiful from the river, from the scrub. When you go to the river, you see beautiful things. It's like walking into a picture theatre. You want to hear music? Go to the river. Natural music, birds, different sounds.
We're here to go the journey with people, you know, and our role is to guide, to offer alternatives, to see where people to go, not to go running ahead of them because you'll leave them behind, and don't push them forward too because that's wrong too. You go, you know, when people are ready to go, you've got to move. When they're not, you've got to still be there ready for them when they are, because there's no point in heading off away from the agenda of the patient.
Okay, thank you, Tess.
No worries. See ya.
See ya.